ريكوردينج بيندينج. ايش فيلمي؟ حسب ايش؟
تعالوا للأمام الآن. تعالوا بنات. تعال تفضلي. تفضلي أمام. يلا تعالوا للأمام.
احنا بايه؟ ايه واحد.
يلا تعالوا.
شو بتعطي؟ نروح احنا دكتورة. خلاص.
شكرا. أشوفكم بعدين.
ان شاء الله. ان شاء الله اكيد.
وين المايك؟ هاي شو هاي؟ هاي من سكري. السلام عليكم ورحمة الله وبركاته. صباح الخير للجميع. وجود مورنينج للجميع. ما شاء الله بس البنات جاية. عن جد لو مو بالكمبيوتر يس أديكم علامات. يس بس مع الأسف صح أديكم علامات وأكثر من علامات. أوكي يا عن جد I will do it but it's not okay. Anyhow, you remember we already started with the occupational health, and you remember we said that the management of the healthcare worker is done by occupational health program. Yes, which is different from the clinical medicine. Okay, that's done at hospital or done medicine, but here with the occupational health program. And you remember we said the occupational health program, it is preliminary, or the main thing is the prevention, and particularly primary prevention as mentioned at that time. And there is so many activity that have been done in the occupational health program, or so many services. And we mentioned these services. We said there are 8, and already we mentioned the rehabilitation. Okay, أنا نزلتها للجروب ذاك مكاننا. Okay, we've finished with the rehabilitation. Yeah. Okay. Rehabilitation, and we said there is 3 rehabilitation activity that have been done. يا بنات الحلوات. Okay, at the workplace, in another word by work health program. It's a psychological, vocational. It means عمل, job, it's not vacation. Okay, there is a difference. And medical services. Now we are coming to the other activity, the 7. Provide special care for vulnerable group. And you know, in anywhere, the vulnerable group are women and children everywhere, not only in the occupation. So namely the women and children. So what can they provide at this for this activity? What they provide, of course, First of all, selection a suitable job for them that match their capacity. Definitely, women and also the children. This is one activity. Pre-placement in another job when the woman is pregnant. When she's pregnant, they should be avoided her to be exposed for some risk. So they replacement in another job during pregnancy. Proper MCH, I am sure you know what's MCH, maternal and child health care services for the pregnant woman, definitely you know. Well, okay, thank you. والله نفسي. Okay, right. Okay, replacement in another job for, okay, for a pregnant woman when she is pregnant. And also a proper MCH. Make sure that the special laws or special order is applying for those vulnerable groups. What are these? What are these law or what are these order? First, no night shift should be given to those vulnerable groups. And limitation of work hours. Okay. Again, paid leave for infant caring when she get labor. Okay. موجودة كل الدول but it differ. So they give her, I think, 6 months here or 2 months. Just 3 months. زمان كان بالعراق 6 months. بعدين يمددوها سنة يعملوها بعدين paid leave. It means like راتبها this is what you mean by paid leave. Okay. Paid leave for infant care and prohibition from working in a certain hazard job. عشان البيبي عشان if she is pregnant okay, this should be implemented. This order or this rule it is implemented. Okay, now you remember we said keep good health record system. It's very, very important to keep a record system. Okay, for a medical record. It is very important. Yes, it is. A health record is a seeing eye of industrial physician. You are quite right. It is very important to have a good medical record for each worker, for each employee. Employee, يعني worker. Okay, for every employee should have an accurate and in detail record. بالتفصيل الممل. Okay, an accurate and complete medical record from his first day he admitted or he came to this job until the time we are seeing him. The record must be in detail enough, provide adequate information about the job placement, when I placed him, what was it, the health maintenance during his work, compensation, rehabilitation, vaccination, everything should be written, okay? Okay, what include? Of course, personal data of the person. This is as any other person, but in detail. Data of pre-placement or replacement. It doesn't matter in this or this. It depends. Okay. Periodic examination. You remember we said pre-employment, pre-placement, and periodic examination. So all this should be written in the record in detail. Okay. History of exposure. What type of exposure? What was the history? And diseases, whether this disease occupational or non-occupational disease that the worker have. It doesn't matter. We have to mention it. No, because we are going to compensate. It's always the money. Okay. History of accident. Sick absenteeism. You remember we said absenteeism is غياب. Absenteeism يعني تغيب. Sick, how many times he got sick absenteeism? Okay. retirement, clinical examination, any previous immunization. It should be mentioned. All this. What's the value of this record? Okay, of course, it will give us a basic data for every person. Basic data. So any deviation in the future, any deviation from this basic data, it means it's due to the workplace. That's why data for a suitable analysis help to know the morbidity and mortality in the factory. تقدر يشتغل إذا معناها not good area environment. Okay, help to see the trend of the health. بشوفها صعد الhealth get better, it will reflect, it means my prevention is good indirectly. So help to see the trend of health disease, help to identify plant area. طيب ليش بهاي الاريا؟ ليش بهذا الكلاس اكثر من ذاك الكلاس صار فيهم infection? So I am going to identify the hazardous area of that factory or of that organization. It doesn't matter. Help to identify the area of high accident or sick or hazardous. And of course, it helps in planning evaluation. أعرف أنه أنا ماشي كويس evaluation of control measure or not. Okay, to evaluation of industrial program. هل البروجرام مالي ماشي or it need modified or it need something else. So this is the important of the. Okay, so we finish with the health. Occupational health program and its services. Now coming with what are the hazards that the worker being exposed to in his or her place, the working place. So there are many types. We have biological hazard, definitely, you know, corona, وما أدراك ما corona. We have physical hazard. We have psychological hazard. We have chemical hazard. All these are and mechanical hazard, definitely. So today we are going to discuss the starting of biological hazard. Inshallah, يوم الأربعاء, Prof. Ashraf, he is going to start with the physical hazard most probably. Okay, now coming to the biological hazard. What's biological hazard? I am sure you know it, but let us say it here. Biological hazard refers to the organism or the organic material or organic product that excreted by this organism. Okay, so it is organism or organic material produced by this organism, and of course it will give it affect the health of the worker or health of a human being, all of us. It doesn't matter. These include, of course, parasite, virus, bacteria, plant, or any other things. It is a biological. Biological hazard broadly defined as any risk that comes from biosphere. Biosphere, human, plant, and animal, all of us, biosphere. So any hazard comes from a human, from animal, from plant, we call it a biological hazard. Occupational biological hazard defined as infectious agent, of course, or hazard biological material that exert harmful effect on the worker. Just غيرنا من الهيومن كلمة worker. That's more than that. Okay, of the worker health either directly or indirectly, definitely. Directly by contact, indirectly by contamination of the environment. Okay, so this will be either directly through infection or indirectly through damage the working environment. And also it includes so many things, medical waste into it's your area طبعا كمedical student and medical provision, sample or microorganism or any other biological sources. Biological hazard, actually, I think you are going to agree with this sentence. Biological hazard present the occupational health and safety present the occupational health and safety provision with a complex challenge. والآن هو اللي احنا بيها بالكورونا. So we are in complex challenging with the corona because corona is a biological hazard. So present occupational health and safety. Why we are concentrated on occupation? Because our lesson or our subject is an occupation. Occupational hazard and safety with the provisionals, with the complex hazard, with the complex challenge. There is a lot of biological hazard and different variety of biological hazard in which the worker being exposed during his work or her work, it doesn't matter. Okay. Although it's well-known fact that the worker in a healthcare or in a community services as well as agriculture and fishing worker are at optimum risk of this biological exposure. But actually every worker in any place being exposed to the biological hazard واللي احنا بيها. كورونا ما خلت لا الهيلث كير ولا حتى اللي يشتغل anywhere حتى اللي عنده مول أو عنده شوب. So everybody, all worker or workplace harboring a potential risk of a various form of biological, at least from person to person contamination, at least هذا أضعف الإيمان وأقل شيء. Okay, so at least from person to person transmission of the infection of disease. And so you are agree with this. As just now I mentioned, everybody or every worker at any place he or she will be being exposed or risk of exposure in biological hazard. So many persons being in this risk, but there is very limited study regarding this field, biological exposure to the worker. انسوا هسه كورونا والناس كلها قامت تسوي بحوث. Yes, but قبل nobody taking care of this subject. For study on biological hazard are very limited. Let us see, this is a study done in Australia, okay? But they found that 19% of the worker being exposed of biological hazard. And 3/4, of those workers, of those exposed, okay, were exposed to human body fluid. Whether any other body fluid being exposed to. So, according to the report, there were 2 industries, just now we mentioned, that are at optimum risk or that they are at risk of exposure to biological. Of course, now you know, just now we mentioned, healthcare workers and community services. All those are at risk. Okay? And in addition, the agricultural worker and fishing worker. So these are 2, but okay, every employee or every worker as at risk he or she at risk of being exposed to the biological hazard, whether directly or indirectly, doesn't matter. In general, there are 3 major routes of entering of the biological hazard to the body of the worker. Of course, by inhalation, definitely, and by contact with the body fluid. Contact with the body fluid, okay, and contact with the contaminated object. This one, contaminated. So by contact with this, it could be either by inhalation, contact with the body fluid, or by contact with the contaminated objects. And of course, the harmful effects of the exposure to the biological hazard are three. It's either infection, definitely poisoning, or allergy. One of these, it could be the out effect. Okay, let us see. We are asking, is this worker at risk? So what will be the answer? Everybody at risk. Every worker is at risk. This is the exam. This is the answer should be. So every worker is at risk of coming contact with some kind of biological hazard, whatever the way of this hazard, whether a human or any other. But of course, there are some industries and workers that are routinely exposed. Okay. اللي بالمول مو دائما بس اللي بالمستشفى yes routinely exposed to the biological hazard, that they are routinely exposed to the biological hazard. Okay, these include worker exposed to the body fluid, بالمستشفى بالclinic everywhere, including healthcare worker, personal services, okay, worker and dental professional. دول taking care personal services يعني وحدة اللي taking care of old person or taking care of those children, okay, abnormal babies. So we call it personal services or dental provision. Of course, dentists are at risk of biological hazard. Okay. Worker in contact with the live animal, definitely. اللي يرعون أو اللي يربون الانيمال، الأفقار الماشية، including breeders اللي يربوها. animal scientists, poultry. Okay, farm worker and other. Another worker in contact with the animal product. Okay, الحليب ويا الميت, including butchers, القصابين, farmers, meat picker, and any other person. Worker exposed to the tick flea. قمل tick flea لا مش قمل، اللاس قمل، الفلي برغوث ما بعرف. التك اوكي او مايت فايروس. Okay, including so many persons, okay, groundskeepers, highway maintenance, okay, personnel and pets control اللي ويا البيتس القطة والكلاب pets العفو pest control اللي تبع الحشرات. sorry. worker exposed to human or animal waste. So هذا المجاري وما شاكله. Okay, or exposed to the taking child care worker, laboratory worker, all these are exposed. Worker exposed to the dust containing pathogen, okay, including building cleaner, okay, or building construction or building any other building. So all these are exposed to the biological hazard. Okay, no. So from this we can classify the biological disease or biological hazard into 6 categories according to the disease and occupation. أنا عرفت راح تسألوني هذا السؤال. هو تحفظوها بس هسه احنا مثلا راح أعطيكم بعض يعني we are going to discuss some of these diseases. انتوا بروسيلس اخذتوهم شايفين؟ فإذا already done لكم. تجي من classification of the hazard, occupational hazard, into 6 according to the method linked disease to the occupation. هاي تسهل لكم إياها هسه شوفوا. First of all, those who are working in contact with the infected animal. Infected, of course, living animal. Brucellosis. Okay. Influenza, Q fever. إن شاء الله راح أعطيكم إياها. plague اللي تجي من البروث rabies and so on. Contact with the contaminated animal product. Thus, with the animal as is. But with the contaminated product, of course, حكينا بها تتذكرون بروسيلوسيس ونعطيكم الصورة تبعها. Okay, leptospirosis, plague and Q fever. Tick and flea. flea اللي هي تجيب لنا الطاعون. Okay, tick and flea might bite. عندنا كثير example, morning typhus, plague, and so on. Contact with the human or animal waste. Human or animal waste, already we mentioned some of it. We have hepatitis A, leptospirosis, schistosomiasis, all these are contact with the infected patient or blood, a lot of things. HIV, hepatitis B, hepatitis C, and so on, so other things. Raising dust containing pathogen. اللي ينظفون فيجيهم الدست contaminated dust. عندنا كثير منها example. Now, these are the disease. So there is a disease. The aim of occupational health is to prevent. It is primary prevention. So we have to prevent and control the disease. So, prevention and control measure, the aim is to eliminate, نمحيها بالتالي, eliminate the pathogenic organism. Okay? This is our aim. But مش كل ما تريدوا you can achieve it. Okay? So we will see. Elimination of the source of contaminations is a fundamental. It's a basic. It's the main aim. It's a fundamental for prevention and control of biological agent. Okay? So, employer يعني صاحب المعمل. Employees هم العمال. Employer and safety provision, whatever, either hygienic or either physician or. So this is the duty of them. Employer and safety provision must take time to identify the positive agent, the biological hazard. Identify it, taking time, and also measuring the level should be. So after identify, they will do a plan for prevention of these hazards. So identify the potential biological hazard and develop a plan to prevent or to control it, to manage it. Okay. When conducting a hazard assessment, just now we said, identify and assess its level. Consider the following questions. So, أول ما أبتدي أنا identifying and assessing. Identifying is not enough. I have to assess. Is here exposure أكثر من لا. So I have to assess. First of all, I should ask, are employees working around people who may have illness or communicable disease? هو بيشتغل مع ناس هم عندهم communicable disease أو يشتغل لناس عندهم communicable اللي هو أنتوا وإحنا. Working around people who may have illness or communicable disease. First, our question. Then, Is there a possible for employees to be exposed to the blood or other body fluid؟ طيب أنا أشتغل يفيدوني أهل الأشياء أنا بالregistration بس I have no contact with the body fluid or blood. Okay. So هذا ثاني واحد. Is there a possibility for employees to be exposed to the blood or other body fluid? Are employees working with the proximity of animal or insect? كمان infected, so the animals may be infected or the animal have insect or there is an insect. Oh. Is the workplace clean of mold and fungi؟ وهلا شايفين mold وما أدري. اوكي. العفن الأسود اللي طلع منه. Okay, so mold and fungi workplace. Are employees working around hazardous material like sewage? You know, does the workplace have sharp material? Okay, that must be cleaned regularly. And nurses, sharp material, they wash it, so they have to clean it. But they are exposed in injured who come on infected. They're both selective exposure. So sharp material that must be cleaned regularly and safety disposal. Is there a biological hazard in the workplace? If there a biological hazard, now لقينا in the workplace, do employees help employees using or having a protective equipment, personal protective PPE؟ هل أجهم؟ مش بس هل أجهم؟ هل يستعملوه properly كمان؟ all these should be mentioned or should be put in our mind when we are going to assess the biological hazard in any workplace. Okay, what to do once a biological hazard had been identified? Once the biological had been identified in the workplace, it is important to eliminate it. نخلص منها للتالي, definitely. Okay, eliminate as much as possible and reduce the risk of exposure to the employees by implementing controls in the workplace. The risk of biological hazard can be greatly reduced if I do control measure plan. We should do a plan. If apply or implement this plan, the risk will be reduced. In some cases, it could be بالأحسن if we can eliminate it completely. So, by plan, we have two methods in preventing the occupational biological hazard. Actually, this two method is not only for biological. It is for most of the hazard, the physical, chemical, even psychological, and also biological. We have two methods should be applied in the workplace to prevent or to control any hazard, whatever that. But here, let us say two. It is administrative and engineering control. two methods. نشتغل على صفحة الادمنستريتيف ونشتغل على صفحة الانجينيرينج بول. Okay, let us see how. So in this case, we are trying to eliminate again, نرجع eliminate as much as possible من حيال التالي. Okay, to eliminate the source of contamination. But if biological hazard couldn't be eliminated, so there is another method for the biological, which is PPE, which is, that's why. So هنا يجي دور منو؟ دور الامبلوير العمال، هذاك دور employee. This is دور الemployees، هذاك دور الemployer. So employer must take step to reduce the risk. That's by provided PPE. So for biological measure, control measure, we have three. We have engineering, we have administrative, and personal or PPE. Okay, let us go one by one. In engineering control, it is the first line. لازم المبنى يكون كويس. It is the first line in controlling the biological hazard. Actually, even in many other hazards, not only biological, but now we are talking about this. Okay, it is the first line of defense. Protecting the worker against biological hazard. Engineering control work to reduce the risk of exposure through physical means. But there are so many physical means, we will discuss it. First, we have, while appropriate control will vary depending on the specific hazard. It definitely حسب الهازارد model. For example, we have containment the laboratory. Containment احتواء laboratory. The first thing in containment laboratory is by negative air pressure. يدخل الهواء من هون ويطلع بقوة من ثانية. So always there is a change in the air of that area. This is the negative air pressure. So containment or keeping under laboratories, microbiological safety cabinet. ما بعرف انتم ما عندكم هون بالمختبرات كل اللي يشتغل بالميكروبيولوجي there is a specific or special cabinet for him or for her, and there is excess one above him. So cabinet, microbiological safety cabinet, proper ventilation, negative pressure, partial isolation of the contaminated area. ما بخليه مع كل إذا هذا contaminated أوديه بعيد. Okay, partial isolation. Installation of negative pressure, separated ventilation. Okay, ما تقدر تودي برا ما عندي إمكانية. Okay, خلي أقل ventilation separated from the other part of the factory حتى لا يروح البقية. This is very important. Separated ventilation and air conditioning system for the contaminated area. Okay, in which there is a biological hazard. Of course, using ultraviolet ما بعرف موجودة بالمختبرات ما بعرف. Okay, ultraviolet lamp موجودة everywhere دائما. Okay, ultraviolet lamp can have contain that spread of contamination. Regular definitely. Pest prevention ما في أي pest. Proper storage كل الماتيريال storage of this material should be properly. Okay, proper transport عليها dangerous على الفلفل 100,000 سير so proper transport, proper disposal. Okay, there is always three part of okay area for disposing biological hazard. That okay, so all these should be done. This is a negative pressure to change the air of the area fast and keep it always clear. Now that's regarding the engineering. Engineering is method. Engineering way. Now coming to the administrative, it means الإدارة صاحب العمل. What they should do. It is a second line of defense. الأول هو engineer, السكند هو الادمنستراتيف. One of the key methods of risk control in this category, safe operating procedure. فإذا لازم البروسيجر اللي أعطيه العامل تكون safe for all the same. So safe operating, reduce risk of changing by changing the work process. إذا شفت هذا risk for him, try to change it. Okay. And activities, make them more safe. Employers must mention in detail. أنا على اللوحة لازم عندي in detail the procedure of the work and the hazard that may he or she will get it during his work. And then also, in case of emergency, I should mention to them what they should do. Okay, all this. So this is the duty of employer, صاحب العمل. Employer must mention in detail procedure and a process that should be followed in order to protect the work. كلها مكتوبة كاملة. Now, example of effective way to use in administrative record, we have, first of all, educated and trained person. We have to educate them and training them from time to time to work safety around, adequate supervision, مراقبة لازم, limiting exposure as much as possible for a biological, limiting the exposure by one way or another. Monitoring the exposure. مش بس العامل، لا أضعوا على monitoring exposure, measuring it from time to time, okay, to assess. So monitoring the exposure, immunization, definitely, you know it. Provided immunization program. Then general sick leave. أعطيهم إجازات معقولة مثل ما حدثت هلا بالكورونا، يعطوهم أسبوعين 3 صح؟ but paid. So general sick. Once administrative and engineering control have been implemented, it is important to revise at least once a year. كل سنة أغيرها. To revise it and modify it for the better condition, or maybe more than once a year. Maybe 2-3 times, it depends. Okay? Or at every time the workplace condition change. لما once a year وهذا صار highly contaminated, so I have to resist again and again. Or صاروا عدد العمال أكثر, so I have to revise it. Depend on the time. Okay. For some workplace, the change or depending on the season. حشرات تطلع مرات بالصيف والشتاء وهذا. So I have to change it. Okay. Okay. Not only that, but even our human body sweating بالصيف يختلف عن الشتاء. Okay. So we have to change. The season can affect this control. It is important to regular monitoring. Just now we said monitoring the biological hazard, okay, in the workplace. Now, coming to the personal protection device or personal protection equipment, whatever. ولا أنتم تعرفوها, you got very good idea about. It's the last slide. آخر الدوائر كيف. Of a defense against the hazard through play critical role. If the control with the biological hazard cannot be prevented, just now we say it, the engineering and administrative, so we have to apply this. Okay, so employees must use personal protective equipment or device, it doesn't matter, and adhere strictly to practice of personal hygiene. They not only use the PPE, but also they should be adhered by personal hygiene. Those two things related to the employees. Okay. The personal protective includes so many things: mask, gloves, protective clothes, eye shield, and face shield, and so on. Let us see. Surgical mask. There is surgical mask. This surgical mask consists of 3 layers. Okay, it is of non-woven fibers. Okay. Okay, non-woven fabric material. It provides a barrier to protect against cancer. كمان شو عندنا؟ N95. It's much better. So خلينا نمشي سريع. Okay, this prevents small particle to enter our body. Now coming clothes. This clothes كلها انتم شايفينها بعد هلا احنا عايشين بيها. Okay, included protective cover all the body. Okay. Protective clothes should be waterproof and impermeable. Impermeable حتى إذا أكو body fluid contaminated or blood should not be go through this clothes to my clothes or even to my body. So this is very good. حتى لو لابسة ملابس, maybe there is a wound or something will affect me. So it should be impermeable and waterproof. To protect liquid to protect the body from it to penetrate. Prevent those contaminated from getting into the body, already mentioned. Protective clothes is usually disposable in most of the cases. Okay, but if we reuse it, we should clean it, then sterilize, then reuse again. If it is reused after sterilization. Protective clothes should be fit the wearer. ما تكون أكبر مني ولا أصغر مني تفيقني عن الحركة. So it be okay. And it should be checked before use. كل ما تستعمل, كل ما whenever you try to put it on, you have to check it before. And if it is damaged, it should be replaced. Of course, the biological contaminated clothes should be disposed in a special design rubbish bag. On this rubbish bag, I should write, it's dangerous. I should seal it very well, okay, completely. And I should write a biological hazard. It should be sealed in this bag. Okay. Gloves, protective the hands. Okay. فإذا خلينا نمشي سريع بس عندي كم سلايد مهم. عندكم الجلوفز of course can avoid infection with the hand and it protect our eyes and mouth by wearing the gloves. Okay, to protect the eye and mouth and nose. And if there is an open wound, so it will protect us. There is a safety goggles and face shield. This one should be fit for the person, okay, to protect his eye, his ear, his nose, his skin, okay. All these should be placed in a plastic bag. After washing and drying, we should wash it and put it in a plastic bag, check them regularly and replace by a new one if it is damaged or shoes. Shoes cover from being carried out outside. حتى pathogenic organism من المعمل ما تطلع برا. Going outside. Shoes are usually disposable after use, and there is protecting something, protective material over it. Boots cover offer further protection. Boots cover. Now, allergen, all the personal protective equipment required. What does these PPE require? What it should be? Correct selection. Fit for you, fit for me. Okay, it should be like that to prevent any contamination. Correct selection by using proper maintenance and storage. That's always. Reusable protective equipment should be clean, sterilized, and put it in a good place. And if it is damaged, it should be replaced immediately. This is now coming to sterilization, another thing for prevention of the of courses. All these are, we are in midst of this during Corona. Sterilization by any other way, okay? Complete sterilization should include disinfected contaminated premises or building. وهذا اللي يحدث. صار كورونا بالكلية، جو الغسل هو and sterilize كل تمام. فإذا this is what happened, or premises or building. Thoroughly clean it. There are, of course, many sterilization type. It depends on the type of the pathogen, depends on the material. It is suitable for this area, but not suitable for the another area. So it is depend, and also a level of organic material assessment and temperature. Maybe it's suitable here, but not suitable in India or in another place. All these, and also it depends on the concentration. Now, of course, personal hygiene. Just now we say the employees should be use PPE and also adhere to the personal hygiene. So this is a personal hygiene. Washing hand before the work and at the end of the work. Okay. Washing hand before and after the work. Washing before and after wearing protective clothes. قبل ما ألبس هذا كل ملابسي I should wash my hands. Okay, and after. By the way, we did a study بثلاث مستشفيات شفنا washing hand أمان again من أسفل the nurse, particularly before putting on the gloves. Okay, hand must be washed thoroughly after taking off the gloves. هذه الحمد لله ملم كانت موجودة. Okay, now hazard control plan. Of course, employer should have written plan. And this will be revised every year minimum, at least. Okay, identify the pathogenic organism, control how control it, and management of this biological hazard. Okay, the plan should be easily accessible to all workers. كل واحد يشوفها. Okay, it should be written evenly. Outline what the hazard is. شو أخليه? There is a hazard in this area كذا كذا كذا. Okay. The procedure and process that should be used to control it. Okay, there is a hazard. فإذا عليكم follow this procedure to protect yourself. Manage them, training employees, and it should be clearly articulated emergency. Also, I should mention when there is any abnormal, they should do these things. Biological control, we said it should be reviewed or revised at least once a year. But again and again, it depends on many conditions. Okay. اوكي اي سؤال؟ ان شاء الله يوم الاربعاء يجي دكتور 10 Okay.